All right, so as I was saying, nice to have you on Morning Scramble with us this morning. We're midweek. I mean, gosh, how fun. And I'll tell you, it is warm through the state, about a couple dozen fires still burning, unfortunately. Gosh, that's pretty tough way to start off the summer solstice, which was yesterday. But hey, here's a good thing to find out. June is, as I was telling Catherine, Aphasia Awareness Month. I don't know about you, but I was totally not aware of aphasia. So we have Erin AAfedt with us today from Mountain Valley Rehabilitation Hospital. Great to have you with us, Erin.
Thank you.
Now, you are the Director of Therapy Operations, so obviously this is something you deal with on a regular basis.
Yes, I am the Director of Therapy Operations at our hospital, but I'm also a speech-language pathologist by training. So I've been working with aphasia problems all of my career, basically.
Got it. Okay, and this is so weird because I've never heard of it. Probably most people haven't, but aphasia does have something to do with, obviously, speech. What in the world is aphasia, Erin?
Aphasia means disordered language, basically. So technically it would be without language, but most of the time people just have trouble speaking, understanding, reading, or writing because of where the brain was injured. And for most people, that's the left side of your brain that contains all the language components. So,
but even if you get hit on the right side, the brain damage, it can still cause this aphasia? Or is it mostly, as you're saying, left side brain injury?
Mostly left side brain injury. Okay. You can have some problems if you got some damage on the right side too, but mostly it's due to damage on the left side of the brain.
How about stroke? Does this cause aphasia, and how does it differ from, brain damage?
Most of the time, aphasia is going to result from having a stroke on the left side of the brain. You can get aphasia if you have a traumatic brain injury as well, if it impacted that language center. Okay. But most of the time, it's coming from having a stroke.
Oh, all right. So it is, which is a cut off blood from the brain,
Yes, a stroke is mostly like a sort of a heart attack in the brain. So you have a blood clot, most likely, that is flowing up and stops at some point in a brain vessel. It could be what we call a hemorrhagic stroke, where the brain vessel breaks open and the blood's kind of spewing out on the brain.
Oh my gosh. Well, the symptoms are so severe with, again, not being able to speak well, not being able to write, not be able to read and understand this stuff. But does it affect intelligence?
No, doesn't affect intelligence. Sometimes it could look that way because a patient can't understand what you're saying. So imagine you are in Japan and you are trying to understand what people are telling you. That's what it's like. It's like somebody speaking a foreign language to you. And some people have more trouble understanding and some people have more trouble speaking. And occasionally it's both. But there's different types.
Yeah, because a lot of stroke victims that I've had association with, some can actually regain their speech and do pretty well, but some, actually my stepfather had some severe strokes, and so this was very much the thing. You're thinking, well, why doesn't he just write out what he can't say? But he can't because there's issues there, and yet he was always there. He was able to.
Yes.
I really felt like he knew what, decisions would say, what do you think about this, Lloyd? And, he literally could remember things, and if he could express to us, if we could understand what he was trying to say, I really believed he understood to a great extent what was,
Yeah,
he was still there.
Yeah, it's very frustrating on the patient or client's aspect because most times they know exactly what they want to say. It's just not coming out. And some people are very severe where there's only one word that they can say, or it's what we call a jargon word that doesn't make sense at all. And then some people have a very mild case where they're just going along and can't find the word occasionally. And you might be thinking, oh, that happens to me all the time. Well, it does as we get older, that we have our word finding problems. But when you have a stroke, it's much more frequent.
Wow. Very, very different. Well, and I know this thing where the frustration for them because they cannot get it across to people, they cannot communicate. I mean, sometimes my poor stepdad would just, you'd say, well, what do you mean, like da-da-da-da-da? And he'd go, I don't know. I mean, finally he would just get so frustrated and you could see he would go, oh, because he just couldn't get it out. Is there a cure for this at all?
There's lots of speech therapy that you can get, and that usually helps. And the old days, a long time ago, they would say, oh, whatever you got in the first 3 months of recovery, that's it. But they're not finding that now, that you can recover language skills or motor skills for years if you keep working on it. So there's lots of strategies that people can use, and if it's really severe, the speech therapist could recommend a computer device that does the talking for them, as long as they have some understanding of picture symbols or be able to read a word. So it depends on each patient.
Okay.
I would say.
So therapy is a big part of making this better in as much as it can be then.
Yes, and family can help too, because the way you interact with a patient, keeping things shorter, not going on and on like I'm talking right now, but making it very simple, pointing to things that you're talking about or writing down things you're talking about. So using a whole bunch of different modes of communication usually helps.
Oh, okay, because we don't think about that so much. We think about the problems they're having, but in terms of trying to understand them, help them to feel more fulfilled and better. Because again, when you think you cannot communicate with people, I don't think we understand how devastating that can be if you are there and you are trying to interact and you're in a foreign country, nobody gets what you're saying. It's like, but where are the bathrooms? Just like, huh?
Yeah, having aphasia and having a more severe form of aphasia can be very isolating. When you think about being an adult, really what you do is you talk all day long and you eat. And usually eating, going out to eat, has to do with talking too.
Yeah, you have to choose what you're going to eat and how much you want.
Exactly.
Yeah.
So it could be a very isolating experience, and I always tell people that if you're feeling depressed, because depression can be a big part of having a stroke, that needs to be addressed as well.
Wow. Oh, this is great. Well, I tell you, it's so fascinating because there's so many aspects to this. And again, if you've never dealt with it, for instance, I had never heard the word aphasia. I mean, here my stepdad for like 6 years was in this situation, and you know all this. I mean, you know what caused it and sort of the issues, but again, I didn't ever really understand why. Can he not just write out what he can't say?
Yeah.
Or why can't he read because he might be bored or something?
It's all language-based. So writing is language-based, reading is language-based. Writing is an expressive form, just like verbal, and reading is a comprehension form, just like listening. So if your listening ability is impaired, then probably your reading and comprehension is going to be impaired.
Sure.
If your talking is impaired, probably your writing is impaired as well, because it's all language-based.
Now, let's say that you have someone in the family who's had a stroke and they're having aphasia. Do you do therapy with the families too, in terms of helping them to know what to do and how to work with
Yeah, we often encourage family members to come into the sessions with their loved ones and see how the speech therapist is interacting, because there's lots of different avenues. You can make it real simple as yes, no questions might help. Sometimes, like I said, writing down. If a person's really struggling to have a conversation, you can write down, okay, what do you want to talk about? The grandkids, the dog, what we did yesterday. And if the person has some ability to understand the written language, they can circle things and kind of branch out from there. Okay, you want to talk about the grandkids. Which grandkid do you want to talk about? And make some choices.
Because then at some point you can understand names. If you have things in context, you may be able to understand what they're trying to tell you.
Yes.
But with no context, it's like,
it's very hard, yeah.
Wow, that is a great idea. That's
having pictures is helpful. And then nowadays with computer systems, there's lots of adjunct to therapy computer programs that we would suggest that they can work on at home to make things better.
Programs and things that, yeah, they can look up. I know it sounds crazy, but there's a children's thing with the different animals and the sounds, and I mean, almost anything it seemed like he was wanting to understand.
Right.
And that helps get those skills back. And wow, wonderful information for us on aphasia caused by strokes or maybe some other damage to the brain.
Yeah, unfortunately.
Wow, well, now we are aware of it. Yay, before June is out. So thanks so much for joining us, Erin AAfedt, Mountain Valley Rehabilitation Hospital.
Thank you very much.
Appreciate it. All right, don't go away. When we come back,